Good evening. Sorry I couldn't be with you tonight, but I'm going to take you on a tour inside the Orchard Pavilion where we're expanding the services for maternal and child health. Let's take a walk. First things that we're doing is improving the entry experience into the building. A new canopy, an entry vestibule, and a new drop-off area is being created. We're trying to open things up, make the entry experience more amenable and easier to find. Once inside, there'll be a security check-in station that provides security for the entire building and a new cafe. We're on the second floor of the building where the new neonatal intensive care unit, we refer to as the NICU, will be housed. The existing NICU is on the first floor, and it's in a bay configuration where we have 6 babies in bassinets around the same room, and that's times 3. What we're doing in the new facility will be private rooms, 19 private rooms, so families can stay in the room with the child and provide support to the care. So in addition to the private rooms, we'll have a 5-bed ward for a total of 24 beds. We're in the corridor. Patient rooms will be on my right. Every patient room has a window to the outdoors. There is a substation between every 2 rooms, so the nurse that's caring for 2 children can observe both of them at the same time. On the inner core, we have support services, supply rooms, equipment rooms, medication rooms, and all of the things necessary to operate in this environment. Now we're actually inside a future patient room in the NICU. The technology and the equipment and the services in the room makes it easier for staff, nurses, and physicians to provide the care, provide the procedures, and do things that need to be done without taking the baby out of the room. You see some of the infrastructure here. Significant amount of care and effort goes into the air distribution systems, insulated walls for sound attenuation, and of course, all of the safety features of hospital construction for seismic and fire safety. Now we've made our way to the 3rd floor. The 3rd floor will be a 26-bed private room postpartum environment for moms and babies. You know, the 2nd and 3rd floor of this building for the last 27 years has been occupied by physician offices. The expansion that we are doing is expanding to these 2 floors. Again, many of the features that exist on the intensive care unit below are present here. Insulated walls, fire safety, anchorage or seismic anchorage for seismic safety. We continue to have our patient rooms on the perimeter, windows to every room, and we have the support services and nurses stations and the center core. See the piping for a pneumatic tube system. Lab specimens can go from here to the lab at 80 miles an hour. Take a look inside one of those rooms. You can see based on the size of the metal studs in this room that the rooms are expansive. So we're making many improvements to the building environment. We'll be upgrading all of the air handling equipment. We have already replaced the windows with new double pane windows. We're making enhancements to the elevators and to the electrical systems, and those enhancements will extend the life of this building well into the future. This building, which opened initially in 1993, happened to be the first building that I completed in my tenure here at El Camino Hospital. And now 30 years later, we are expanding it and improving it and making it a better place for patients to receive care. It will provide the best in the Bay and likely the best in all of California. We do appreciate your support. Thank you.